Welcome to Veteran Connection, VA Butler Healthcare's cable show. We bring important news and information to our veterans and friends of VA Butler Healthcare. I'm your host, Cynthia Closkey. Thanks for tuning in today. Our focus is on VA caregiver support. My first guest is Mrs. Bonnie Smith. Bonnie Smith is the primary caregiver for her husband, Vietnam veteran Randy Smith. Bonnie recently started coming to VA Butler Healthcare for the monthly PTSD caregiver support group, which provides support, encouragement, and guidance to caregivers whose veterans have PTSD. Hi, Bonnie.
Hi, Cindy.
So what's it like being a primary caregiver for your husband?
It can be difficult. I guess the people that suffer with the PTSD, they have a control issue, mainly because they feel if they're controlled, then nobody can hurt them. And me being an independent woman with somebody who is control-oriented, it can cause some conflicts. But we, through the VA, through his therapist, he started coming here in 2010. With his therapist, they always invited me to come along because that way they could get both his feelings and my feelings and work together, and gave us tools to use to see the trigger points and how to express each other's feelings and without, a roadblock or anything like that. So,
what was it that first caused you to take the advice to come in?
Well, over the past 42 years that we've been married, Randy has had episodes where he feels like his emotional supply is depleted when big stressors come into the picture. And he had been saying things and thinking things that were somewhat a big concern to me. And in 2010, in August, I insisted that he seek help through the VA. And pretty much told him, if you don't call them, I am going to call them. And so he did, and whenever I didn't go the first appointment because I wasn't aware that it would be beneficial for the couple for me to be there. But our therapist, Joanne, invited me to come, and which I did, and other than not on a time when I wasn't feeling well or something, but I would say 98% of the time I went to every appointment with him. And that helped us to work through problems and teach us how to communicate with each other.
It's a whole skill set that you probably had to learn then as a caregiver. Like, these things are not necessarily obvious every day.
Right.
How to handle and how to help someone.
Right. Because you just don't know. Do you just sit there and keep your opinions to yourself and not rock the boat? Because they have enough on them, right, as it is. Or do you say what you think and help us as a couple get over that hump?
Tell us about the services that you've used here then. What has been helpful for you?
Well, mainly I would say with his therapist, Joanne. She's very, very good, and his Dr. Niebauer, I met her a couple of times, and she did show us a film on Vietnam action, and that she wanted me to see so that I would understand what he went through.
Right.
And I actually had a little bit of a nightmare that night, but not scary, but it was like I would never have thought of those situations. But I also, last month, they started a caregiver program here at the VA, and they meet every third Wednesday of the month from 2:30 to 3:30 here in the conference room on the second floor. And it's totally anonymous. We just go by first name. And they have two girls, I believe they're social workers actually, that present the program. And it gives you a chance to meet with somebody that's kind of in the same boat that you are, and you can share what you want to share. You don't have to share anything. You can seek help through the VA, and the girls also know other sources that you can tap into when you need to.
Right. It's probably almost a relief to know that you're not the only one.
Yeah, you're not alone. It's nice to know you're not alone. And I think living with somebody with PTSD, you do feel alone because you seem to walk a straight line, and you're not sure what's the proper procedure, you know, and you need to have that guidance, and you need to have that support.
I can see that there's lots of challenges to being a caregiver. Are there rewards as well?
Yes. We've really made a lot of progress since we've been coming to the VA, and we've actually been able to communicate with each other. It's not always something that maybe I want to hear or he wants to hear, but we're able to put that out there in the fact that we say, well, this happened and this is how it made me feel. And the reward is that my husband is able to be a happier person. His personality and his way of dealing with things and so forth is more like the young man that I fell in love with, but didn't come home from Vietnam.
So you're starting to have him back?
Yes, finally. And I attribute that all to the VA and all of his hard work.
Sure. It's work on everybody's part.
Yes.
Absolutely, on his part as well.
Mm-hmm.
What advice would you give to other caregivers who may be watching today?
I would definitely encourage them to come at least to the meetings. You can't go wrong because there are so many people, professional people here at the VA, that really do care. They really do care. They really want to help you. I can't say enough about them. They're just wonderful. And I just think that you should give it a try.
There's meetings how often?
Every month on the third Wednesday from 2:30 to 3:30. And it's pretty nice because not only can you receive help, you're actually able to help others that are there because you've lived it. You know,
That's rewarding in it.
Yes, yes, it is. And if, you know, you go through a tough time and you're able to take that tough time to reach out to somebody else, it's pretty cool.
Okay. Makes it worthwhile.
It does make it worthwhile, and it gives us a feeling that what we've gone through, we can contribute to help other people. So if you're a caregiver, I would really highly recommend that you do that.
Terrific, Bonnie. Thanks so much for sharing your story.
Oh, you're more than welcome.
Here with me now is Karen Glebe, VA Butler's Caregiver Support Coordinator. Hi, Karen.
Hi.
What services are provided for caregivers here?
We have quite a few resources here for caregivers. We have the Adult Day Healthcare Program, we have respite care, hospice, we have home telehealth, and we have some caregiver support groups, and quite a few different programs that are available to support caregivers in their role.
Who's eligible for these programs?
There are resources for all era caregivers, so basically any of them may qualify. All they would need to do is check with a member of their primary care team or myself, and you can find out information about how to get enrolled with one of these resources or what the eligibility criteria might be.
So are some of the resources newer for the more recent era veterans?
Yes. Based on recent legislation that was passed, we have some extra resources beyond those that are eligible for post 9/11 veterans, and that includes a monthly caregiver stipend that is paid to the caregiver. We have CHAMP VA health coverage, mental health services, and there's some travel reimbursement and lodging and per diem that's available for training purposes or for veteran appointments.
And then who is eligible for the new services?
The new services are open to veterans that either incurred or aggravated an injury, which would include traumatic brain injury, psychological trauma, or mental disorder, on or after September 11th, 2001, and they would require the personal care services for at least 6 months, as documented by their clinical team, and also that they would be willing to, and it would be in their best interest to receive personal care services in their home.
And if someone has a question, they can probably talk to any number of people to figure out, am I
Yes,
eligible?
yes, definitely. They're able to contact myself. You can contact any member of your primary care team. And there are resources available online through our website, the caregiver.va.gov website.
For a new caregiver, I'm sure there's an awful lot for them to learn. Is there education or training or anything for a new caregiver?
Definitely. That's one of the things that we're really working on providing to all era caregivers. With the new benefit in particular, the VA has contracted with Easter Seals to provide a very comprehensive caregiver training that they complete at the very beginning of their application process. But the other thing is that we have trainings available for caregivers that as issues arise, relevant to their veterans' care or diagnosis.
It seems like one of the things for caregivers is just sort of realizing that they could use help, that there's something that would be helpful for them, or that their experience is maybe different from someone else's.
Definitely. It's one of the experiences that I've found, that basically reaching out and letting them know that there are resources for them here also, not just for the veterans, that there's support out there, and the fact that it's okay to ask for support, that it's perfectly acceptable to have some people to give you a little bit of assistance.
And there are support groups as well, right?
Yes, we have support groups several times a month. We have general support groups in person. We have a support group for PTSD caregivers. And we also have a telephone support group for those that can't maybe get out of the house or if the weather's too bad.
Sure. It seems like that would be an important addition, because if you're a caregiver, you feel fairly lonely sometimes, it seems.
Yes, it's been a great opportunity for people to meet other people that are in similar situations and realize that they're not alone, or that there may be creative answers that they never even thought of that someone else was using in order to fix a problem.
Mm-hmm. Just to have a shoulder to lean on, or
yes,
a sounding board.
It is.
That kind of thing.
Yes, definitely. It's worked out really well. I've seen some really great connections between caregivers at these groups.
And you mentioned that if someone wants information about it, they can talk to you, they can check the website, and then
yes.
There was another website you named, the caregiver website itself?
Yes, they can either access our VA Butler website, or there's a national website that is www.caregiver.va.gov. And that people can apply online for the new benefit. They can be linked to their closest caregiver program, and they can find out all kinds of different resources about caregivers and what's available for all era veterans.
If there's one thing that our audience should take away from this conversation today, what would you want them to remember?
Well, just to remind people that caregivers could be a variety of different people in your life. It could be a spouse, a significant other, it could be an adult child, it could be a neighbor or a friend. And we also provide resources to veterans that are caregivers for someone in their life. So it's just important, because sometimes I think people don't realize how many different ways that someone could be a caregiver.
And resources are available for all of these people.
Yes, definitely.
Thank you so much.
Oh, you're welcome.
It's time for Health and Wellness with Karen Dunn, VA Butler's Health Promotion and Disease Prevention Manager. Hi, Karen.
Hi, Cindy.
So today we're talking about falls. How dangerous are falls?
Well, falls are pretty dangerous. They're the leading cause of injury deaths among older adults, and about half of all falls happen at home. So, falls are the most common cause of non-fatal injuries and hospital admissions. About 25% of people over the age of 65, when they fall and fracture their hip, they die within a year. Another statistic, about 40% of all nursing home admissions are related to a fall.
Well, how does the VA help veterans and their caregivers reduce the risk of falling?
We have a program, it's called the Home Safety Assessment, where someone comes out and will assess the environment at home, to make suggestions. So that's available for veterans, if they request it.
Do veterans and caregivers have ways that they themselves can help make their homes safe?
They do. There's many ways that the veterans and their family members can make their homes safe. One of the best ones is to remove throw rugs. If that's not an option for them and they really want to keep the throw rug, they should use a double-sided tape or an anti-slip mat underneath the rug so it doesn't move and make them fall. Other areas with lighting to improve it in the home, and to use like shades or lightweight curtains to reduce glare, and that helps with vision problems. Some other ways would be to encourage them to wear shoes inside and outside. We don't want them to go barefoot at all, or to wear slippers, because a lot of tripping with slippers. Some other areas, probably stairwells. We want to keep those clear, and anywhere where they walk in general. Non-slip mats in the bathroom and in the shower. Lots of falls happen in the bathroom. Grab bars by the toilet and also in the shower and tub areas. And on stairwells, obviously you should have handrails and some nice lighting. And anywhere there's low cords on the floor need to be taped down, things like that.
It's probably helpful to have that home safety assessment then, because you might not yourself notice all the things because you're so used to being in your home.
Exactly.
But having someone come in with a professional eye to see the risks and point them out to you. And then you have a checklist. You can just go through it.
Right.
That's perfect. Can veterans and really anyone do anything else to help themselves reduce their risk of falling overall?
They can. They can reduce their risk of falling by engaging in regular physical activity, especially strengthening exercises. That helps them with their strengthening, of course, and balance. Balance could be an issue as we get older. What we recommend for that is about 150 minutes a week, and 2 days would include the strengthening exercises. And it's really simple. All they would have to do basically is walk, or they could do Tai Chi. That's good for balance. Some really easy exercises while you're in the house and just doing regular everyday chores. While you're at the sink, maybe doing dishes, you can stand on one leg at a time, or roll up on your toes, roll back on your heels, and do that. That helps balance. First, they might need to hold on, and then once their balance gets improved, they wouldn't have to hold on for assistance to help with the balance. But they can always call in and get recommendations from their team.
It seems like a lot of these exercises, when people think exercise, they think I have to get all sweaty. But some of these, particularly the balance ones, they're really not. They're things you can do just in the course of your day.
Right, and it helps because once we, when we get older, we do lose some of our balance, and just doing things like standing on one leg and trying to balance yourself, or just standing on both feet and not, trying to sway, that actually helps with balance too.
And it's probably important not to get discouraged because you build it up over time.
Exactly, just like any exercise routine, it takes a while to get improved.
Thanks so much, Karen. This is very useful.
Thank you.
Welcome back. I'm joined by Paula McCarl, VA Butler's Voluntary Service Coordinator. It's nice to have you here, Paula.
Hi, Cindy. Thank you.
You're going to tell us a little bit about the volunteer program?
Yes, we have a wonderful program here at VA Butler Healthcare and a dedicated group of volunteers. I'm constantly inspired and awed by their commitment and dedication. Last year we had over 500 volunteers, regular, scheduled, and occasional, that provided close to 50,000 hours of volunteer service, performing a myriad of programs such as escorting, mailings, assisting with special events, flu clinics, health fairs. We also had individuals that helped with collection drives, that did fundraisers, and made contributions to some of our specific programs and services. And we have a list of those available upon request for anybody who's interested. Our volunteers here augment the programs and services of the VA to help ensure that the best care possible is provided to our veterans.
That's wonderful. How does a person become a volunteer?
Well, it's fairly easy. The first step is to inquire and then to schedule an interview. I prefer face-to-face interviews so I get a better understanding of the individual and what their interests are. And then if we have a match, then we proceed to the next step, which is to complete a volunteer application, and then we schedule them for an orientation. Then pending the authorizations from the orientation, then they are assigned.
Can young people volunteer as well?
Yes, yes. The minimum age to volunteer is 14. They must go through the same process as an adult does. They complete the application, however, they have to have parental consent. and then they go through the orientation. There are a few assignments that they are not permitted to utilize, but otherwise we can use them. We have a summer program that runs from June through September. We're actually getting ready for that, in which specific assignments are developed for them, and then they can pick and choose which assignment best meets their interests and needs. And then they can volunteer anytime throughout the year as well, when school is out or in the evenings and weekends.
There's probably a lot of different areas that you can volunteer in. What are your priorities right now?
I have 3 priority areas. My first priority area is volunteer drivers. Our focus area is in Armstrong County. The volunteer drivers transport our veterans to and from their VA medical appointments. They will drive our vehicles so they don't have to drive their own. We have vehicles donated to us through the Disabled American Veterans and also the Rural Health Initiative. The other priority area are greeters in our primary care outpatient clinic, our main lobby, and our newly opened community living center. Those are during the day, Monday through Friday. And what the greeters would do is welcome individuals to the facility, escort them to their appointment if needed, and assist with other things as directed. And then the third priority area is escort. We need individuals to transport patients internally to their appointments and help with other odds and ends activities. And those days are Wednesday, Monday, and Friday in that order.
It is a little confusing sometimes here at the
can be.
medical center, so I can see why that would be helpful.
Yes.
And that's a nice one too. You get to chat probably with the veteran.
Yes, they very much enjoy that.
What other benefits are there to volunteering?
Well, the greatest benefit is to give back to the veterans themselves. That is the primary reason why most of my volunteers are here. The other reason is we offer a safe, friendly, comfortable, and working environment so they don't have to worry when they're here. They have an opportunity to make friends, to build positive relationships. There is opportunities to learn new skills, possible trainings. We offer free lunch, free flu shots. Also, health. It's good for their health, actually, to volunteer, especially in escort, because many of them have pedometers and they walk all over the facility.
Get in your 5,000 or 10,000 steps very easily.
Yes, and the other thing, which is for youth or for adults as well, is that volunteering looks good on a resume, college application, scholarship application. It just looks good. So we encourage anybody to come in and volunteer.
Terrific. So if someone wanted to find out more about volunteering here at VA Butler Healthcare, where can they go?
They can check us out online at www.butler.va.gov, or they can contact me directly at 724-285-2575.
Fantastic. Thank you so much, Paula.
Thank you.
And now, to answer questions from our veterans, here's Sharon Parson, Associate Director for Patient Care Services. Hi, Sharon.
Hello.
What question do you have for us today?
The email that we received today is, I am the primary caregiver for my husband who was seriously wounded in Afghanistan. Are there any financial resources available to me? And actually there are. In 2010, Congress enacted the Caregivers and Veterans Omnibus Health Services Act, and this allows for financial compensation for veterans and their family caregivers. Two of the financial benefits available under this act include monthly stipend for the caregiver, as well as transportation funding for accompanying veterans to and from their appointments. And for any veteran who would want further information about this, you can contact the Caregiver Support Coordinator at 724-285-2492.
Thank you, Sharon. If you have a question that you'd like us to answer in a future episode, please email it to vetconnect@zoominternet.net. And with that, we wrap up this episode of Veteran Connection. Thanks to our guests today, Bonnie Smith, Karen Glebe, and Paula McCarl. Anytime you need news and information about VA Butler, we have lots of resources for you. Please visit our website, www.butler.va.gov. You can also friend, like, retweet, or follow VA Butler on our social media pages, facebook.com/VAButlerPA and twitter.com/VAButlerPA. Please also join us for our monthly podcast at talkshoe.com/TC/85029. You can listen live online or by phone, or you can download past episodes. Thanks for joining us today. Check your local cable listings for the next episode of VA Butler Healthcare's Veteran Connection, where we're making lives better every day.